to assist physical therapists and other qualified healthcare professionals with treatment and diagnosis of patients who present with peripheral vestibular hypofunction. The Academy of Neurological Physical Therapy has written a CPG. The CPG helps with assessment of patients who have vertigo with reports of dizziness, patients who have reports of visual blurring, and patients who have imbalances. Today we're going to focus on patients with reports of visual blurring and imbalances or falls.
To address patients who have visual blurring with head movements, one intervention that we would use would be gaze stability exercises, which help target any remaining vestibular function that they have. These would include VOR1 or VOR2. So what I did here is I went ahead and folded a piece of paper and put a target on it in order to perform VOR1 and VOR2. So, patient 1, for VOR1, you will be having this piece of paper out in front of you. You will be turning your head while your eyes remain on the target, okay? So he will be performing this for 1 minute, and he'll be doing it 3 to 5 times. So next we will be performing VOR2. So with this one, you're gonna have the paper out in front of you, and you're gonna be turning the paper and your head in opposite directions as you maintain eye contact with the target. And as you feel comfortable, you can speed it up. For unilateral hypofunction, you could do VOR1 or VOR2. For bilateral hypofunction, you can only do VOR1. So for the gaze stability exercises, we demonstrated horizontal. You could also do vertical, and as a way to progress it, you can always do a busy background, have them stand up, have them come to a narrow base, tandem, etc. There are a few rules to remember with gaze adaptation exercises. First, we have to determine whether the patient has unilateral hypofunction or bilateral hypofunction. For unilateral hypofunction that is acute, you would do the exercises 3 times a day for 12 minutes. If it's chronic unilateral hypofunction, you would do it 3 times a day for 20 minutes. If the patient has bilateral hypofunction, you would treat it the same as if they had unilateral hypofunction that is chronic.
Continuing with the patient presentation of visual blurring with head movement, we're going to proceed as though the adaptation exercises of VOR1 and 2 weren't having the intended effect. So in addition to doing smooth pursuit or saccadic substitution exercises, we'll go more into depth for gaze shifting. So in order to do this, we'll use our fingers as targets. The first exercise, you'll start beginning with one target, you'll look towards the other, and then shift your head to correct. Once again, look towards the target and shift. This can be done vertically as well, and this will be done for 1 to 2 minutes, 3 to 5 times. I'm going to have Ty demonstrate that for me. Very good. So for remembered target, I'm going to demonstrate it first before having Ty perform it. So what you will do here in the horizontal is you would have 2 targets. You would start off by looking at one target, you then close your eyes, shift your gaze to the other target, and open them. Correct as necessary, close your eyes, perform again. Regarding progression, the similar progression of being performed seated, standing, And modifications to basic support, such as modified tandem or tandem stance, or even compliant surface, could all be performed, and it could additionally be progressed by doing a plane versus a busy background.
Next, we're going to demonstrate and discuss treatment strategies for patients who have been diagnosed with peripheral vestibular hypofunction that report to the clinic with complaints of falls or imbalances with gait. Good. Our patient here today has been experiencing falls and imbalances with gait. We're going to go through a progression of treatments to help prevent future falls and improve the patient's balance. First thing we're going to do is we're going to stand with our normal stance width, and we're going to be looking to our left and to our right to help stabilize her balance in the static position. Whenever you're ready to look left, right. You'll assess the patient to see if there's any additional sway or loss of balance or riding reactions to maintain their balance. Good. Tie looks stable in this position. So now we're going to increase the difficulty by bringing our stance to a narrow base of support. And then you're going to continue to look left and look right. Good. And again, in this position, Ty seems to have a stable, static position. Okay, Ty, a little bit more difficult this time. We're going to stand in a tandem stance. So we're going to go heel to toe. Good. Now this can be a little bit challenged. You might want to guard the patient, and then you're going to look left and look right to see if the head turns provoke any loss of balance. And Ty appears to have pretty good balance in this position. Good. So now we're going to incorporate these head turns with a gait, which were the reports that the patient had were the most challenging. It's important to note that you can do the static balance exercises on a non-compliant surface like we've shown today, but to increase the challenge, and maybe the first step before you start to add in dynamic gait activities would be to perform them on a compliant surface like a foam pad. Okay, Ty, we're going to do a few steps here. As you walk forward, I'm going to tell you turn left, turn right, or look straight, or stop. Okay, are you ready? Mm-hmm. Let's go. Good. So look right, look left, straight, and stop. Again, we're looking for any deviations in gait that might give the impression that the patient is having difficulty with their balance. In this case, Ty has done well with her treatment. She had no balance deviations. Again, always guard the patient. Because they're at a risk of falls, you want to be as close as possible to them, just in case the head turns do provoke some of those imbalances.